class, back again for the week 4 assignment. Today we're going to talk about the benefits of a smoke-free campus or workplace. Smoking is the cause of 480,000 deaths per year in the United States alone. That equals about 1 in 5 deaths overall. Smoking causes more deaths than HIV, illegal drugs, alcohol, car accidents, and firearms. It's also the cause of 90% of lung cancer. The health risks that go along with smoking are it increases your risk for coronary heart disease 2 to 4 times. The same with stroke. Increases your risk for a stroke 2 to 4 times. In men, your risk for lung cancer increases 25 times, and in women, it's just higher, 25.7 times. Smoking can cause increased absenteeism in work, causing you to miss work for health reasons or behavioral reasons, whatever the reason is. It also can increase your health care costs. And aside from that, more of the health risks are it decreases your lung function, lowers the level of oxygen in your blood, and it really is just harmful all around to your body. There's really no positive benefit to smoking. The benefits of quitting, if you look here, after just 20 minutes, your blood pressure improves to a more normal level. Your pulse rate decreases, which can lower your blood pressure and improve your heart's function. After just 12 hours, your body's carbon monoxide level decreases to a more normal level, and after 24 hours, your risk for heart attack decreases. This is just after 1 day, and then 36 hours, the oxygen in your blood increases to a healthier level, and then after 48 hours, the nerve endings in your entire body start to regrow. Nerve endings that were damaged by cigarette smoke. Exercise becomes easier due to better lung function, and then your senses, your smell and your taste actually improve due to the lack of chemicals going through, and this is just after 2 days. 2 to 12 weeks of non-smoking can cause your lung function to improve, along with your circulation to your limbs, your hands, and your feet. And then after 10 to 15 years, your life expectancy actually goes back to normal, about a person that had never smoked. So the benefits of a smoke-free environment are it eliminates secondhand smoke for your coworkers. So even if you choose to smoke, there's no need that they be exposed to it. Victims of secondhand smoke, for example, women or men that live with a spouse that smokes, have a 20% higher mortality rate. And every pack smoked for a smoker equals about 3 to 5 cigarettes of secondhand smoke for in the same room indoors. And this is, again, a non-smoker who's not choosing to be exposed to this. Role modeling, causing positive lifestyle habits are, I got some statistics here about childhood obesity and how it relates to, and how it can be transferred through childhood into adolescence and even into adulthood. And the same can be said for children that are exposed to smoking. The health problems that they're exposed to when they're children can continue to follow them throughout the rest of their life. So you really want to set a good model for them when they're young. The stages of change. There's 6 stages of change, and first is pre-contemplation. And in this stage, you really want to encourage people to make better small decisions. They're just kind of beginning to think about changing their lifestyle, so you want to encourage them to have maybe a bowl of fruit instead of a bag of chips for a snack. And then contemplation, they're really starting to consider making some changes, but they still think the cons outweigh the pros of changing their lifestyle habits. So you really want to reduce the perceived cons. For example, like people that want to start eating healthier say that healthy food doesn't taste as good. You really want to try to show them ways that healthy food does taste good. Preparation is when they're really deciding that they're going to make a change and they need to start making a plan. You want to help to encourage them to have a decisive plan, because the more rigid of a plan you have, the more likely you are to stick to it. and you want to help them maintain that course. In the fourth stage, the action stage, you want to reinforce the current path they're on and help them avoid unhealthy behavior. Reward healthy behavior, for example. Maybe encourage them to buy themselves, reward themselves on a new pair of shoes if they've gone a month without smoking. In the maintenance stage, this is after, for example, after you've quit smoking. You want to avoid relapse that could be caused by stress. A lot of people tend to revert back to that. You really want to avoid that. And then the relapse stage is what you want to avoid. You don't want to fall back into smoking. So health coaches and encouraging family members can be beneficial to help avoid relapse. 2 ways to quit smoking. One of them is nicotine-containing gum. It requires you to quit smoking immediately. The success rate when you're being guided by a doctor is about 40%. And there's 2 to 4 milligrams of nicotine per piece of gum. Basically what you do is you chew this gum, and it gives you the nicotine through the gum so you don't feel the urge to get it through a cigarette. The second way is through a transdermal patch, often just referred to as a patch. It relieves nicotine withdrawal symptoms. There's 2 different ways to go about it. There's a single dose, which provides the same dosage throughout the course of the treatment. Usually it's 15 milligrams. And then this, again, encourages you to get the nicotine this way instead of through cigarettes. And the second way is a step-down method. It provides varying doses, gradually lowering. As you can see, it lowers the dosage of nicotine throughout the course of the treatment. And this is designed to make the symptoms from withdrawal less severe, and it degrades it more gradual over time. And here's a list of my references. Thank you.